Did you hear estrogen might cause breast cancer? If you've been following along, welcome back to part 2 of our mini-series discussing some of the common myths with hormone replacement therapy and why they might be safer than you think. And today we're going to be talking about one of the most common reasons why most women are too scared to start HRT, the risk of breast cancer. Yes, I am a medical provider, but if I am not yours, this is not medical advice. You'll want to be sure to ask your provider about any questions you have specifically related to your health. So let's get straight to it, the $1 million myth. Brought to you by social media headlines, outdated research studies, and of course, that one cousin who saw something on Facebook. Before we can talk about bioidentical estradiol, you need to know what it is. Bioidentical estrogen means that it is identical to the estrogen that your body naturally makes. So we'll just call it the Beyonce of estrogen. And while it is created in a lab, it's designed to match your body's natural chemistry, making it a much better fit than the synthetic forms of estrogen in previous hormone therapies, like the kind that was made from pregnant horse urine. Ew. And before you ask, yes, that is a real thing. And so why does everybody think that estrogen causes breast cancer? Well, that's because the information released from the Women's Health Initiative way back from 2002 showed that there was an increased risk for breast cancer among many other complications. But here's what they didn't tell you. Participants in this study were taking synthetic conjugated equine estrogens and synthetic progestins, which is a fancy way of saying horse urine. The participants on average were after 12 years menopause when they started treatment, and the study was even stopped early because in the combined therapy group, there was an increased risk for breast cancer. But guess what? The group that took estrogen alone with no synthetic progestins actually showed a decreased risk of cancer. Yep, you heard it right, less cancer. But instead of relying on research from over 20 years ago, let's look and see what the latest research says. Like this study from the North American Menopause Society that shows that HRT, when started in women that are younger than 60 or within 10 years of menopause onset and have no contraindications, show that the benefits definitely outweigh the risks and are effective in treating vasomotor symptoms, which just means hot flashes, and prevention of bone loss. Or this study from 2019 that showed that transdermal estradiol, when used in early menopause, decreased the risk for cardiovascular disease, improved hot flashes, bone density, sexual function, and had a favorable safety profile, including no increased risk of breast cancer. Over the past 2 decades, medical researchers have been working really hard to redeem the reputation for estrogen. So instead of asking ourselves, does estrogen cause breast cancer? The real question we should be asking is how we can safely use estrogen without all the drama. So here's my opinion on the top things to consider when starting HRT. Number 1, go topical. While creams are my favorite, there are many variations, including gels, patches. They bypass the liver, reducing your risk and help you to avoid the hormone roller coaster. Number 2, pair it with the right progesterone. If you still have a uterus, micronized progesterone is the most safe and effective way to protect the uterine lining. Number 3, start early. The window of opportunity giving you the best benefit to risk ratio is 10 years within menopause and always under age 60. And lastly, customize your care. I cannot stress enough, HRT is not a one-size-fits-all treatment plan. Your dose, delivery, and regimen should be tailored specifically to your symptoms and your risk profile by a knowledgeable provider who understands hormones. So the important takeaways are, what can bioidentical estrogen do for you? Reduce hot flashes, improve mood, decrease anxiety, preserve bone density, and protect your joint, lower your risk of heart disease, and improve your skin elasticity. What it won't do is turn you into a bodybuilder, cause cancer when used appropriately, or reverse aging. Sorry. But it might make you feel like you again. And no, estrogen isn't trying to kill you. It's only trying to help guide you through this next chapter like the queen that you are. If you're intrigued and want to keep learning about HRT, stay tuned, because in episode 3, we're going to be talking about what every woman wants to know. Why are my hormones causing so much weight gain? Or are they?